We are here today joined with representatives from the University of Utah Health, from Steward Healthcare, and from Intermountain Healthcare. And we're here today to talk about the shortage that's facing many hospitals across the country, but also here in Utah, of critical walking devices made of metal, including crutches and walkers. We're joined today by Dr. Joey Kamarath with Intermountain Healthcare. He is the Medical Director of Rehabilitation Services. We're also joined by Martha Gamble. She is with Steward Healthcare, and she is the Chief Nursing Officer. And we're also joined by Dr. Daryl Brodke. He's the Department of Orthopedics at U of U Health. They're here today to talk about a new campaign and effort to collect and hopefully from people's closets and also their garages, maybe some spare crutches they may have laying around. The campaign is going to be called LeanOnUtah, and we're hopeful that residents in Utah can help us out and help other people in need. And so we're now going to turn it over to them. They're going to talk a little bit about how the shortage is impacting them and hopefully how people can help. So I think we'll start with Dr. Joey Kamarath. If you please introduce yourself and then just tell a little bit about what you do and how this is impacting your area of healthcare.
Thank you, Glenn. As Glenn mentioned, my name is Dr. Joey Kamarath. I am the Senior Medical Director for Rehabilitation at Intermountain Healthcare, where we care for patients across the state and their rehabilitative needs. And throughout the Intermountain region. I'm so grateful today to be joined by our partners and collaborators in this effort, the Steward Healthcare System, the University of Utah Health. The Utah Hospital Association is also participating with Intermountain Healthcare on this effort to acquire this needed equipment for our patients. We are indeed in desperate need of your crutches, walkers, wheelchairs, and canes in order to provide our patients with the care that they need. At Intermountain Healthcare, we go through 1,800 pairs of crutches every single month. Yet, unfortunately, our supply chain has ran completely dry of this equipment. Now, the national news media has put a lot of attention on the shipping crisis, and that indeed is a part of the problem. Unfortunately for us, the issue is much more complex. There are unique issues with attaining the raw materials needed to create this equipment. And there are also issues at the fabrication stage. And so really every stage of our supply chain is affected. And we don't have even an idea of when this equipment will be available for us next. What we do know, unfortunately, is during this period where we cannot get this equipment, that members of our community will continue to suffer from strokes. Children will continue to be involved in motor vehicle accidents. Members of our community will have sports-related injuries or require other surgeries, and they will all need this equipment for their safety and to aid in their recovery. And we can't get this equipment through our supply chain, which is why we are reaching out to our community. Now, this problem is not unique to our region. This is something that is being felt across the entire country. What is unique to the Mountain West is a very strong work ethic, a commitment to service to our community and reaching out and helping your fellow man. And so this is another time for us to step up and help support this LeanOnUtah campaign. We will be collecting donations at multiple healthcare facilities the next 3 Saturdays. Please go to LeanOnUtah.com to see these locations. We really could use the help of individual youth group volunteer organizations or other volunteer organizations to help organize community drives, to help gather this equipment from local neighborhoods and deliver to our drop-off points. Although we're in this period where we can't get this equipment that our patients need, the healthcare providers on our teams are extremely grateful for the privilege of practicing healthcare in this region of the country where we have such a strong community with a reputation of stepping up and stepping in when we need your help. So thank you so much for pitching in and helping us out to take care of our community members.
All right, thank you, Doctor. And now we'll go to Martha Gamble, Chief Nursing Officer. So if you just want to tell us a little bit about yourself, introduce yourself, and then just talk about how this is impacting Steward Healthcare.
Absolutely. Thank you. And thank you for having me. We at Steward are incredibly excited to be able to join this collaborative effort in collecting crutches and non-motorized wheelchairs, walkers, and canes. And actually, to echo what Dr. Kamrath is saying, Utah is by far the most giving state in our union. And I am very proud to be a transplant to Utah. And so the message that I want to express is that we we have been navigating this really uncharted, unprecedented time for the last couple of years. And this is just another way that we get to continue to show up for our community. And now that we're coming to our community and saying, show up for us, show up for your neighbor. Let's be proactive before it becomes a tremendous crisis. Look under your beds, look in those closets and those garages. I know we've got them. That's another issue in American culture is sometimes we hoard things, and this is a great opportunity for us to be able to get rid of a little bit of that, make room for other things, and give back to our community. So while our supply is not 100% depleted, our levels really are low. So here we are asking for the public's help, and I'm really excited to be able to join together and see what we can do, and to lead the nation and let the nation see what Utah can do. So thank you very much for this platform to be able to ask for this help.
All right, and now we will go to Dr. Daryl Brodke, if you want to introduce yourself and then just again talk about a little bit about how this is impacting UVU Health.
Sure. Thank you, Glenn, for having me. My name is Daryl Brodke. I'm the chair of the Department of Orthopedics here at the University of Utah, and I'm honored to be here today with my colleagues. And I would echo everything that they've already said. This is a unique time and a unique need. Particularly, we've been hearing about supply chain issues for months now affecting various industries. And to see this now right in our own industries, affecting our own patients and our own population here in Utah, it's really important time for us to come together. This is a time when a lot of orthopedic surgeries are happening and people require crutches and assistive devices in recovery. It's a time when more injuries may be happening in our mountains. And again, people require this kind of additive, an important tool for ambulation and getting around in order to really heal well from the injuries and surgeries that our community is seeing. I would say that with this program, we really get to come together as a community, and it really gets to engage everybody. Everybody has crutches, as was already stated. Everybody has an assistive device. Everybody's had an injury or a family member or a Facebook friend, and this is a time for us to come together and help those in need. Thank you for allowing us to be here.
All right, thank you, Doctor. And those are our introductions for our friends in the media. If you have any questions, please put them in the chat and we will be sure to ask those. Just say the organization that you're with. And our first one is from Chris Reed from St. George's News. Is the shortage purely from the supply chain situation, or is it an increased number of patients during the pandemic? Has that been a factor? Dr. Kamrath, do you want to answer that a little bit and just talk about the supply chain?
But yeah, I'd be happy to answer that. Thank you. That's a fantastic question. You know, our hospitals are at a greater capacity, and they have been consistently for the duration of the pandemic. But this problem really isn't that our need for this equipment has increased drastically. It might have increased a slight amount, but really the kink is in getting this equipment to us. Fortunately, we've not had any patients yet that we didn't have the equipment that they need for them, but we're getting close to running out because of the many issues currently with the supply chain. And as we engage proactively, we really are at the forefront of healthcare communities in the country in getting ahead of this problem and reaching out to the communities to mitigate any effects that this could have on our patients.
Thank you. And Dr. Brodke, could you maybe answer for us the importance of this kind of equipment in moving around and why it is after something like an orthopedic surgery or even an injury, why it's actually good for patients to move, even though it might be a little painful, and what important role crutches or walkers play in that healing?
Absolutely, thank you for the question. That's really an important point for everyone to understand. That the surgery that somebody undergoes, whether it's for hip or knee arthritis or a broken ankle or leg, really is the first stage of healing. Once we have everything in place from the actual surgery and maybe the few days after surgery that require sort of acute care, the next period of time is really about allowing the body to heal. And that often requires not putting full body weight down on the limb as we are trying to allow it to heal in appropriate alignment and with good strength. And yet we need to be able to move around to decrease some of the risks related to immobility, which can be significant. And so crutches, canes, wheelchairs, walkers all play a key role in both keeping excessive force from coming down on the leg or limb that's being treated, but allowing people to be up, mobile, moving around, and participating in their day-to-day lives. And so this plays an immense role in a patient's healing process.
Thank you, Doctor. We do have a question from Paul Nelson from KSL Radio. Have the manufacturers given any timeline on when they can get back on track to making these crutches and other walking devices? Martha and Dr. Kamrath, do you want to maybe weigh in on that? Martha, maybe you go first.
Thank you. So just like so many other things that have been affected by our supply chain during this crisis, timelines are not something that are communicated because there are so many unknown factors. And I think that's part of why we're all here in this collaborative trying to reach out to our community.
Yeah, I agree 100%. Every one of our healthcare systems has reached out to every potential supplier for this equipment across the country, as I'm sure every other healthcare system in the country has. And the answer that is consistently attained is that we don't have more equipment for you, and we don't know when we're going to have more equipment for you.
Dr. Kamrath, this question's for you. And if you don't know the specifics, feel free to say so, but are there shortages specific that you know of to St. George Hospital or the Southern Utah regions?
So I can only really answer this question specifically to Intermountain Healthcare. We know that all healthcare entities are being affected by this. My awareness is of our supply chain issues within Intermountain Healthcare. We do have the advantage of increased volume and scale and a supply chain network. And so there's not any one region that's feeling the squeeze any more than any other region in our network, because we have the logistical support to be able to even out equipment across our entire network. I'm not sure if other healthcare systems that don't have quite the same level of economy of scale have regional disparities, but that's not the case for Intermountain Healthcare.
And can you, and this is for everyone here, can you maybe go one at a time and explain why this is coming at such a critical time, considering that we're going into November and December, which for people who don't know and that aren't in healthcare is normally the busiest time of year for orthopedic surgeries, which require these walking devices. Do you maybe want to each one go through, maybe we'll start with you, Dr. Brodke, and just explain why that is?
Sure. So as we come to the end of the year and many people's deductibles have been paid up, and they're looking to complete their health care before the new year starts. This is the time when everybody's interested in getting an elective surgery or semi-elective surgery that has been put off to really complete their health care needs, hopefully before the end of the year. And so this becomes a really busy time of year for that. This also in orthopedics happens to be a busy time of year, believe it or not, for early injuries in the winter ski sports, which we are so well known for in Utah. And those two things really come at a crucial time for this supply chain issue and problem, because we will see an increased demand need right now as we are moving into the fall and early winter, right as we're trying to sort out what it is that we need to help care for our patients. And this is where our community becomes so important, And that is one thing that we have that is unique. It is an amazing community here in Utah to help support each other.
If I could add to that, Glenn, thank you, Dr. Brodke. I agree 100%. Utah is unique during this period of time because not only do we have our own local population to care for, but many people travel to northern Utah for our skiing attractions, and many people travel to recreate in southern Utah during these months. And all of these recreational activities come with a risk of injury. Now, we end up caring for patients from all over the country during these months. And this is really a time to let them show what our Utah community is about, that we care about other people, and that we want to make sure that you get the best quality healthcare that can be provided. And as we've mentioned, a key part of that healthcare is having the equipment that you need to recover. And Dr. Brodke alluded to this, but it's more than just mobility for the sake of mobility because you need to get to the bathroom, although that's extremely important. But having these patients move around after these orthopedic procedures it's really important to prevent potentially life-threatening blood clot formation. And so really our community's efforts, although it's very hard to measure and quantify, will help not only improve the quality of life of our patients, but likely help prevent the unnecessary complications or even potential loss of life that can come through immobility.
Yeah, I think that everything's really been mentioned, but what I want to add is this is an incredible opportunity in our time, and this is a very responsible act in this collaborative effort for us to kind of get ahead of this and to start the narrative before this becomes a crisis. So, I mean, the good news is this: as you're decluttering and you're finding this equipment, and again, we're talking about crutches, non-motorized wheelchairs, walkers, and canes. So as you're finding this stuff, you have all of these facilities that you can be dropping it off to. And I know at the Steward system, we're going to be collecting 10 to 2 for the next 3 Saturdays in a row. And for those that are interested in who the Steward facilities are, we are Jordan West Valley, the Jordan Valley Medical Center at Jordan in West Jordan. We have Salt Lake Regional, Mountain Point, and Davis hospitals. So you drop it off 10 to 2 on Saturdays, and we will make sure that we have the opportunity to clean them, inspect them, repair them, and get them ready to give back right into our communities.
And Dr. Kamrath, another question came up just talking about maybe the resources, places people can go to find other locations, both at Intermountain and at Steward, and just explain why we're doing it over the next 3 Saturdays.
Well, so we came up with multiple potential logistical plans and how to address this. And we really do currently have a labor shortage. And so bringing our efforts together, our marketing efforts, our brainstorming potential ways to provide solutions, really coalescing all of this to one website where our community members could come together and see the different locations and just bringing it to the location nearest to their home. Doing it over a 3 Saturday period really gave us the best opportunity to maximize the efficiency of our workforce, both our own employees and a large volunteer workforce that's going to be used in this effort. I mean, my own teenage daughter, I was talking to her about this past weekend, and she said, "Dad, we can get together with my friends and set something up. How would I do that?" And we talked about the good old days when you sent flyers around the neighborhood. I don't know what the best thing is for every neighborhood in Utah, but I believe that nearly every neighborhood has a volunteer youth organization that would be happy to pitch in and help the members of our community that need this.
And maybe, do you just want to, Dr. While we have you, do you maybe want to talk about just the concern level that some doctors are having? I mean, people talk about how this is unprecedented, and and maybe through all of your medical experience, you can talk about this, but have you ever seen a shortage like this before? And what's your biggest concern going forward as you see the supply of these vital medical devices dwindling?
So no, I've never seen this. I've practiced healthcare in various continents. I recently moved from the Middle East, and every time I come back to practice healthcare in North America, I'm so grateful for our supply chain that we take for granted in healthcare. It has never been an issue for me in my career while practicing healthcare in the US. Whenever I needed a piece of equipment for the mobility of my patient, it was always immediately available. And now all of a sudden we can see that we can't order anymore, and we're left with those pieces of equipment that we have in our local facilities. They can't be restocked through the supply chain anymore. And that's unique. Again, never in my career have we been in this situation. I hope that it'll never be that way again. It is a unique time with all the things going on throughout the world of our international community and supply chain issues that are being felt in multiple industries. But as Dr. Brodke alluded to, it's extra painful when you see it hit healthcare. And I was on our rehab unit just last Friday and thinking about our stroke patients, and several of them are absolutely dependent upon a walker to be able to ambulate. How tragic would it be if we did not have a walker to provide for a stroke patient? I was on the phone with the leaders of rehab at Primary Children's Hospital on Friday, and fortunately, they still have all the equipment that they need, but it's very low. I mean, what a tragedy would it be if our healthcare providers didn't have equipment for a child who needed crutches or a walker in order to be able to get around. So we're not there, but we're close to being at the point where we just won't have the equipment that they need. And I'm grateful again to be in this community where we can mitigate that through this strong sense of community identity and service, that there is plenty of equipment available out there. We just need help getting it from your closets to our patients.
And if I may add, I think that this is an incredible opportunity for us to bring some good. I think that a lot of times the media takes on the spin of all the horrors that are happening. And here we have this opportunity to control the narrative. And the narrative really is that we can get together as communities, as youth groups, as churches, as high schools, as whatever community members we are, and gather together and collect this stuff and be able to give back to our community. So what an incredible narrative that we get to control and put out there. And so similarly, as a Gen Xer, I've never experienced a supply chain issue in my life, quite the opposite. And now that we're navigating it, it brings me back to my high school days, where we heard about the good old days of World War II and what that looked like and how everybody got together. And by no means am I saying that we're there, but I am really excited to be able to have our children and the people that are looking at us, and also the world that is watching us, to see how we're navigating this and how we're controlling the narrative, to be able to say, hey, you guys, this is some tough times, but this isn't anything that we haven't overcome before, and something that we won't be able to continue to navigate through in the future.
I want to echo exactly what everybody has said. It's an amazing time. I've been in orthopedic surgery around this country for the better part of 30 plus years. I've never seen the supply chain issue affect assistive walking devices. And to be in this situation now, while unique, I couldn't imagine being in a better place to manage this, and the opportunity for our wide community to really get involved, and involved in a way that includes all the healthcare systems in this state coming together to solve this problem, I think is a unique benefit of where we live, and a great opportunity. Thank you.
And I am seeing no more questions, so I just want to thank everyone who took part in this today. I want to thank members of the media and everyone else for joining us. Again, we will be doing these drives for the next 3 Saturdays from 10 a.m. to 2 p.m. And you can find a list of all the drop-off locations, including all the Steward Health and Intermountain Healthcare drop-off locations, at LeanOnUtah.com. There's a list there that everyone can find. And we ask that everyone please do what they can to help. That's it for now. And for all of our members of the Spanish language media, if you'd like to stick around, we do have a representative that can do an interview in Spanish for you. But other than that, thank you everyone for joining us, and have a great day.
Thanks, everyone.
We are clear, Glenn. Let me stop this recording really quick.